I'm pleased to introduce to you now our next speaker. She's one of the most passionate representatives of the multicultural community. She started off as a healthcare consumer, that was just with her friends and families using health services here in Australia. But then she became a carer to family members with mental health conditions, and it was that experience that really prompted her to become a serious advocate within her community to ensure the voices of members from diverse groups would be heard. She's a founding member of the Tamil Women's Development Group. That's a Sydney-based community group for the empowerment and well-being of Tamil women. She's also a board member of Pink Sari Inc, a female volunteer community leaders group with Indian and Sri Lankan background women who have taken over the running of the Pink Sari Project. Now, that's focused on the empowerment of South Asian women, and it's all in regards to respecting and achieving positive health outcomes. She's just been chosen as a carer representative on the COLD. Now, we know what that acronym means, I hope. Culturally and linguistically diverse, and sorry for using the acronym, mental health consumer and carer group of the Federation of National Multicultural Mental Health Project. We're very lucky to have her joining us here. Please welcome to the stage Ms. Viji Dayanathan to speak on the consumer's perspective on healthcare. Please welcome her.
Thank you, Janice, for that introduction, and it is always great having you as an MC for this event. Dr. Kerry Chant, distinguished guest, ladies and gentlemen, I also would like to begin by acknowledging the traditional owners of this land on which we meet today. I pay my respect to the elders, past and present. This is a hard act to follow after Naomi and Kay. Naomi spoke about the big picture, what can be done in the health system on this issue, and Kay spoke in a broken down on an individual basis how it can be done. And it was really humorous to hear Kay relating being a CALD patient and her experience. And I think that would have really opened our eyes what the CALD patients go through in hospital on a daily basis. So thank you, and it's a hard act to follow. Yes, the policies are there, but we have to make sure the policies are working. It is in the policy that if there are CALD patients to use interpreters. I can tell you now that it doesn't happen all the time. Either doctors or health service providers are too busy to ring through and get an interpreter, even though that service is free. And that is the most basic thing that you need for your communication. If you can't communicate to the patient correctly, then where is the health literacy? So it is not important that you see 20 patients if all 20 are going to be buggered because you have not communicated properly with them. So take your time to talk to them, please. As a consumer, that's what I can appeal to you. I'm honored and very excited about speaking today. And I told my family and friends about it. And the other day, one of them asked me, but what does health literacy mean? This bring me to my first 3 insights today. If you work in the health system and are coming up with new terms or jargon, please talk to your friends and family members who are not from the health system or have a health background, and try to explain this concept in a way that a non-health person will understand. I reflected on the health literacy resources that I have come across and my own experience. So going back to the question of what I said to my friends, the heart of health literacy is good communication and being aware of the assumptions we make about people and the language we use. I reflect on the health, you have seen the slide there. Here's an example. A few weeks ago, I attended a meeting as a consumer representative. During the meeting, I heard a health professional say, "We need a cow. We will have to get a cow." And all around me, I could see all the other health professionals agreeing. And I thought, what is this? A cow in the hospital? So I had to turn around and ask, why are you bringing a cow? And how will it solve the problem? And I came to know that cow means computer on wheels. Now that makes all the difference to me. Yes, I do understand how that will solve the problem, but I have no idea how a cow will solve the problem. So please be aware of this. And the other thing I would like to say is, in each hospital, there are hundreds of little committees. Please make sure you have consumer representatives in that committee, because you may do fantastic work there. But if that work cannot be communicated to the consumers, to your patients, all that is useless. So do have consumer representatives in whatever working committees that you have. And if you can, make sure at least one is called. Have to make sure you have one is called representative. Now, it's another problem. As a consumer advocate, I have encountered similar sounding words. Hyper and hypo. As a called person, I don't know the difference between that. But for a medical person, yes. So if you just talk to me about hypo and hyper, I won't understand that. So take time to say one is high blood sugar and the other one is low blood sugar. Make it simple. Don't use, big words. I like to point out that it is not just the acronyms and the jargon, but also possible implication in terms in health. One word I have seen is patient activation. Now this term to me, and possibly to many community members, is of how you activate or put life into a robot or a lifeless passive object. It may suggest that health workers have all the power and the knowledge to activate a patient, that we have no agency. Certainly, migrants and refugees who make it to Australia have the resilience and the agency to help themselves and should be active partners in their own health care. We just need better communication. In this regard, I have to look at the posters displayed outside this auditorium and would like to thank all the great work of the various local health districts and their work in health literacy, especially the ones that collaborated with the consumers from the culturally and linguistically diverse backgrounds as partners. Many years ago, I had to act as a coordinator and advocate for my sister who had dual disabilities, intellectual disability and later mental health issues. At that time, both were dealt by two different departments who worked as silos. There was no communication between the two departments. Hence, they were offering conflicting diagnosis and treatment for my sister. I had to navigate the various systems. Today, I would like to thank the various New South Wales health system, including the various pillars of Clinical Excellence Commission and Agency for Clinical Innovation for the advances in the coordinating care. Thank you. My example, I believe, highlights the need for the health system to also consider the health literacy of not just the health consumer or the patient, but also the support network of the patient. For culturally and linguistically diverse consumers, this is particularly important, especially for those with limited English, as they often ask their friends or family members who speak English to come along to support them. I would urge, which I have done before, all health professionals not to use friend and family members as an interpreter. Health professionals would not be able to or have the time to determine the person's level of English literacy, the helpers. Of course, the person may be able to speak better English than the patient and able to assist the patient with other daily tasks such as taking them shopping or taking them out into the community. But they are not trained in medical terminology. So, please use accredited interpreters when you're communicating with CAL patients. Before I finish, I want to share some practical tips and messages to fellow consumers, especially those migrants from refugee background. When booking an appointment with healthcare providers or doctor, remember that you have the right to book a professional healthcare interpreter. When you book your appointment, let the service know you need an interpreter in your language. Prepare your questions in advance. Write them down. One very useful resource I find is the question builder. Depending on the nature of your visit, for example, it's a routine visit. No, it's new symptoms, or you're going for the first time, or a follow-up. The site generates questions for you to ask the specialist. We all have a role promoting health literacy. So please take a photo and tell everyone about this website. I want to end with an image I found on Clinical Excellence Commission site, which to me captures the essence of a supportive health professional working with us consumers. A good health professional is not too busy to help, does not use big words. They sit down and listen. Ask how you are doing today and what your problem is. They ask you how you want to be addressed and don't read the chart in front of you. If they do, it shows they haven't prepared for your visit, which is rude and demeaning. Good health professionals tell you things in plain English and break them down to what is really important. If you don't understand what they say, you're comfortable asking them to repeat the explanation. When they repeat it, and you still don't understand, they go out of their way to make sure you do. Thank you very much.